So our next presenter, our next speaker is Leah Hemphill. So she'll be talking on why phasing out fossil fuels is more important now than ever before. So Leah is the manager of the environmental program Clean Air at the NB Lung, leading initiatives and advocacy that address the environmental factors affecting lung health, such as radon gas exposure and indoor outdoor air quality. Coming from a background in emergency response management and public health policy, she brings an expertise in translating complex management and public health policies to bring the environmental health issues into a practical strategy for community healthcare professionals and policymakers. So we see that her slides are on, and over to you, Leah.
Thanks, Chantal. Yeah, good morning. Like Chantal said, I'm here to talk to you about the health harms of fossil fuels and why it's more important now than ever before that we are phasing them out and transitioning to clean energy, and also how you can help with that. So, fossil fuels have been in the news a lot lately, but outside of the very few specific communities that are directly, facing an incursion of new fossil fuels, it probably isn't at the forefront of most of your minds. Um, so myself, as Chantal said, with my background in public health policies, I'm especially interested in things that we can do to prevent illness from occurring in the first place. And as health professionals in New Brunswick, you already know how air quality, heat, and other environmental exposures are affecting your patients because you see it every day. So my goal today is just to make you think about fossil fuel phase out, that it's not just a climate policy, but that it is something that's really imperative for the health of all New Brunswickers. So first thing, when we look at the local health lens in our province, there's already 1 in 5 New Brunswickers that are living with lung disease. COPD exacerbations are the second leading cause of hospital admissions after childbirth, and lung cancer is our number one cause of avoidable mortality. We are number one in Canada for lung cancer diagnosis and death. This is all from the New Brunswick Health Council's 2024 report. They also reported that 67.4% of New Brunswickers are living with at least one chronic health condition, and a further third of them have two or more. So we, as a population, have a much higher disease burden than the rest of the country. Also, as you know, relevant to the local health lens is that air pollution is now ranked second as a leading risk factor for mortality globally, behind only high blood pressure. That is up from 2019 when it was the fifth leading cause, or leading risk factor for mortality, rather. So in just a few years, it's getting significantly worse. As of 2019, 99% of the world's population was living in places that do not meet the World Health Organization's air quality guideline levels. So we tend to think of air pollution as something that happens in densely populated cities, like in far off places, maybe, China. But that 99% statistic really brings it home that this is something that affects everybody everywhere. So even though our air is comparatively pretty clean, New Brunswick does still experience premature deaths due to air pollution. That clean air preconception that we have, it's probably one of the reasons why there isn't a lot of New Brunswick specific data. But what we do know is that from Government of Canada's Health Impacts of Air Pollution report that came out in 2023, using data from 2015. So it's not new, but it's one of the newest reports we have. In central New Brunswick, 31 deaths. Southern New Brunswick, 14 deaths. In northern New Brunswick, 7 deaths, all directly attributable to air pollution. And they're report the following year in 2024, looking at data from 2017 to 2019, puts that at closer to 400 deaths per year across the province. So those numbers are looking at only three key pollutants, particulate matter, nitrogen oxides, and ground level ozone. These are all really strongly tied to fossil fuel combustion, but there are many other pollutants. These are some of them. So we don't have time today to go into a really in-depth look at all of these pollutants. But if you do want a more detailed report, the Climate Health Alliance has a really great report called Cradle to Grave, which does a deep dive into like peer-reviewed research and global case studies. Um, and you can find that just by searching Cradle to Grave, and they go into detail on each and every pollutant. But I want to just if we just look at one of them today, I think ground level ozone is really interesting, especially in New Brunswick, because there's something called the ozone paradox, where rural areas, which New Brunswick predominantly is, they actually produce higher concentrations of ground level ozone than urban centers do, despite supposedly having cleaner air. So the ozone layer, as we know it, it exists in the stratosphere, which is like 10 kilometers above our heads. And ground level ozone isn't normally a problem, and it isn't even directly produced by combustion. What actually ends up happening is that it's created when the nitrogen oxides from fossil fuel combustion react with volatile organic compounds in the presence of sunlight. VOCs are also produced by fossil fuel extraction, combustion, the whole life cycle. And that reaction is a cyclical reaction. So normally, the nitrogen oxides are continuously breaking down, forming ozone, and then more nitrogen oxides are reacting with that ozone to break the ozone down immediately. But in rural areas where we don't have as much vehicle traffic, and we have much kind of wider open spaces, we don't get the buildup of nitrogen oxides that you see in cities. We do, however, have a lot of surplus VOCs from natural sources like vegetation. VOCs are like aromatic compounds generally. So even the scent that flower release, things like that. So what ends up happening is that the nitrogen oxide that is released from fossil fuel combustion here reacts with the VOCs, but then it exhausts all of the nitrogen oxides and there are no more to break down the ozone. So the ground level ozone ends up building up to really high levels in rural areas. And we care about that for lung health, especially because it has an immediate harm on our lung cells and airways. It doesn't get stored or built up, but it damages the cells immediately. It's really similar to how bleach can kill cells. It is an instant reaction, and it's incredibly noxious to our airways. So, I mean, that's one pollutant. So just know that if you do take a closer look into any of the fossil fuel related pollutants, you will find similar causes for concern with each and every one of them, which is why the World Health Organization has come out and said that air pollution is the biggest environmental risk to human health today. So just keep that in your head always, that fossil fuels equal health impacts. It doesn't matter what stage of the use of fossil fuels it is, whether it's the extraction or the storage or the combustion or the transport. Fossil fuel use affects us at all of its stages, and it affects all of our life stages, right from fetal development through to old age. This is kind of a quick snapshot of some of the harms that it has. They are persistent, they're systemic, and it does not end with exposure. So there's a really wide range of health harms across all of our body systems listed in here. And each one of these increases the risk of hospitalizations, and each one can contribute to premature mortality. Infants and children are particularly vulnerable because of their faster breathing rates. They take in more air per kilogram of body weight. They have narrow airways, their organs are still developing, and they're also less able to metabolize pollutants than adults are because of their developing immune systems. On the other end of the age spectrum, older adults are also vulnerable because of age-related natural decline in organ function, pre-existing chronic illnesses that they might have developed in their lifetime, and just a lifetime of cumulative exposure to any pollutants that they've come across. But it, when we talk about who is most at risk, yes, it's seniors, it's infants and children's, but the chronically ill are a really big portion of that. And if we go back to those numbers with that little snapshot of New Brunswick Health, 1 in 5 already with lung disease, and nearly 70% of us living with chronic illness. All of New Brunswick is like so very vulnerable to air pollution. Um, it's yeah. So the one good thing in all of that is that there has been a really positive shift in our modern day mindset to health. We don't just view it as being free of disease anymore. We look at it as the complete physical, mental, and social well-being. Um, so in other words, how our social and environmental conditions shape our capacity to live healthy lives right from birth, all through our lives as we grow, as we live, as we work, as we age. Um, Government project planning, on the other hand, is not always in line with this. And um, what what we're really worried about here is that the way New Brunswick is going is we cannot, as a province, achieve this broader definition of health if we don't implement health forward policies and investments that support clean energy planning and clean energy industry so that we can reduce all of those sources of outdoor air pollution. So, um, why do we want you as healthcare professionals to speak up now, specifically? Um, in New Brunswick, we're rife with inequities. We have the highest rate of energy poverty in Canada, 52% higher than the national average. That means that energy poverty is when people are paying more than 10% of their household income on energy. And in that situation, when people are having to choose between energy and their food or their rent or their medications, we can imagine how that has a flow-on effect on health. We also have a higher low income rate and a higher child poverty rate compared to anywhere else in Canada. So you already all, I'm sure, know firsthand the strain that is on our health system today. It's already working at, or probably in most cases, over capacity. And we do have that higher than average disease burden that I mentioned earlier. There are also climate related poor air quality days that are happening more frequently with wildfires, especially as we've seen in the last few summers. And these air quality days are driving up exacerbations of the chronic conditions that we have an abundance of in New Brunswick, which are causing, more emergency room visits. And um, on the other hand, we have clean solutions that already work for energy production, and New Brunswick has really promising potential for growing these renewables, like especially wind, solar, and tidal energy. They've also been shown to be the fastest and most effective pathway for universal energy access. So, despite these unmet health needs and fewer people having access to regular healthcare in our province, what we found at NB Lung talking to people is that New Brunswickers really do value their health. And in the public, there is an overwhelming majority that is opposed to fossil fuel investment and developing new fossil fuel projects. Um, on the international front, the world is also moving towards clean energy. The International Court of Justice back in July they issued a really landmark advisory that said that governments have a legal obligation to protect people and their ecosystems from the threat of climate change. and that they could be held legally accountable in future lawsuits for having climate harming practices. So part of that ruling was that they cautioned that the production and consumption of fossil fuels can actually now be considered to be an internationally wrongful act. Um, and New Brunswick has has a great current and detailed climate change action plan already that lays out a commitment to the development of clean and renewable energy. The Clean Energy Canada, which is a think tank run from Simon Fraser University, they actually looked at our climate plan and they said that it's one of the country's most comprehensive strategies in line with best practices and that it was a roadmap that other provinces should be following. Um, so, what's the problem, you ask? Well, uh, the New Brunswick provincial government currently is pushing for a new fossil fuel plant to be developed in the Tantramar region. Um, it's going to be American owned as well, which is another issue. They're also asking for expanding natural gas pipelines to connect with Quebec, and they have plans to export natural gas overseas. There was a federal review of the project that ended last week, and it found that no further impact assessment was required. However, the federal impact assessment doesn't contain any health considerations. So health has not actually been looked at all yet for this project. Um, the mayor of Tantramar asked the province to do a more detailed impact assessment, and the province declined. So as of now, um, there has been no health consideration in the development of this project. Um, And we see that as a big problem at NB Lung because we're basically being told that pollution is mandatory, and they're giving it the great name of Renewables Integration and Grid Security Project, which makes it sound like it's a really green step to be taking. But it isn't. Fossil fuels are not a clean technology, and we've known that for decades. What it is actually, it's really short-sighted because it's a 25-year contract with outdated technology that is tied to really volatile international gas prices. So it's going to end up costing us more as well as the end user. Um, so today, um, try to keep it quick, but today what we really want to urge you as healthcare professionals to do is to talk to your patients about air quality when you can. We'd like you to advocate wherever possible for policies that are health smart and that help accelerate New Brunswick's transition to actual clean energy. And look for other organizations you can partner with to spread that message. So New Brunswick Lung is one. We would love to work with you. And we we just want to help people breathe better. And this fossil fuel issue is a really difficult issue. And right now it doesn't feel like it's one that we're winning. So what we do have is we have a really great advocacy letter on our website that's pre-written, but we need more voices to contribute to that letter. So you can go to the URLs on the screen or scan that QR code. All you need to do is put your name, your address, your postal code in it and hit send. That letter then automatically gets sent to your regional MLA and MP, as well as the relevant ministers within New Brunswick. You can also customize that letter if you want, but it is something that they have to look at. Like they're mandated to read these letters. So, and not only read them, but respond. So the more people that we have speaking up and saying, no, New Brunswick does not want more fossil fuels, but, especially not American fossil fuel. We want clean energy. We want to be able to breathe and protect the clean air that we already do have. Um, and we'd really love your help with that. So, um, you can also reach out to us, or your organizations that you work for can reach out to us to discuss other ways of amplifying that call for health first energy policies. And yeah, we'd really love to work with you. So yeah, please get in contact. And thanks so much for listening to me today. Do you have any questions?